Thank you so much, Helen. Just firstly, thank you for having me along this afternoon. As Helen said, I'm Cathryn Appleby and I'm a professional advisor who works for the Chartered Society of Physiotherapy, the CSP. I'm along today with my colleague Cathryn, who's going to just introduce herself to you now as well.
Hi there, everyone. Just wanted to drop in and introduce myself too. So my name is Cathryn and I work with my colleague Cathryn at the Chartered Society of Physiotherapy as a campaigns and regional engagement officer. So I'm not a clinician like Cathryn is. But what I would like to start with is just a request, if you're comfortable to do so. It would be helpful to us if you would type a short message in the chat and let us know why you're here today and essentially introduce yourself. But please don't feel any pressure to share any sort of personal details, but just give us a feel for why you're here, and that would be really helpful. Thank you.
Perfect. Thank you, Cathryn. I'm just going to share my screen so that you can see the presentation for today. And can I just firstly apologise for the quality of my picture? We have lovely webcams that we use, but mine's on the blink today. So hopefully you can still see me. I thought it was better than a black screen. So yeah, just thanks for having us today. As I said, I'm Cathryn, I work for the CSP. And today I'd like to just talk to you a little bit about the physiotherapy profession itself, what we do and the role that we have within the healthcare system. And I'm also just going to make you aware of some of the work that we've been doing around strength and share some resources that hopefully you'll find helpful, either as an individual or in a professional capacity, something that you can draw on to further your knowledge. So first of all, just to start, so what is the CSP? So we are the Chartered Society of Physiotherapy, which is the professional body for physiotherapists. We're also the educational body and the trade union. And our members are made up of chartered physiotherapists, so they are our qualified physiotherapists, which I am myself. But we also have students and support workers as well, who are a really valuable part of our workforce. So in total, we have 63,000 members, 10% of which are students at the moment. So it's clear that we have a really big collective voice to allow us to work together for better services, to help support and provide opportunities for staff and students, and ultimately to help improve patient care through physiotherapy and the wider healthcare system. So although we do a great deal of work at a national level, we also work on a regional level to help campaign, influence and support our members. So we have 13 regional and country teams to cover all of the regions and the devolved nations. So Cathryn and myself are part of the North East team. Cathryn has been for a long time. I've only joined in the last month, so I'm fairly new. But I'm based in the Northeast. I'm based in Gosforth and I'm born and bred Northumbrian. So hopefully I'm welcome in this group. So I was born in Rothbury and I've worked in my professional career across the whole of the Northeast, from Hexham and Haltwhistle through to South Tyneside, and lately in Newcastle as a physiotherapist. So I'm really familiar with the area, really passionate about the Northeast and its people. And I hope that in my job that I can just be a good link between the CSP and healthcare within the region, so that I can be engaged with what's going on to help influence what we're then doing in response to that and vice versa. So a little bit about physiotherapy itself. So one of the unique things about physiotherapy, I think, is the breadth of knowledge and skills that we have, as well as a wide range of settings that we work in. So imagine most people have a specific idea of what physiotherapy is, and it's often linking to musculoskeletal physiotherapy, so your sports injuries, or perhaps orthopedic physiotherapy. So you might think of rehabilitation after a hip replacement or a knee replacement. And that's absolutely right. That's a huge part of what we do. So in the Northeast, we have various private physiotherapy clinics that you can walk into and book an appointment for treatment. Within the NHS, we have the JMAPS service. I don't know if anyone's come into contact with them, but they are the Joint Musculoskeletal and Pain Service. And we have orthopedic teams who do offer rehabilitation after surgery in Hexham General and in the Wansbeck. So you might have come across those, but there's so much more to physiotherapy out with that as well. We work in so many different specialities, some that you might not be familiar with. So, for example, physios have a really big role in intensive care and working in acute respiratory wards. I think through COVID, people saw a little bit more of what physios do in that respect. But yeah, we're really responsible for assessing and treating patients' chests as a start to their rehabilitation. You'll also find physios in A&E departments. So for example, NSEC will have physios who are based in A&E, and their role is to assess patients with a view to providing them with equipment or support or advice for getting them home. Or it might be if the patient needs to be admitted, that the physios would help smooth that transition from A&E to the wards. You'll find physiotherapists within paediatrics working with children, within mental health services, working in oncology. One of the surprising areas that people don't expect is within pelvic health. So in Northumberland, actually, we have a really big team, the pelvic obstetrics and breast health team. And so they're based right across the region, from Alnwick to Berwick, Blythe Community Hospital, Hexham and the Wansbeck. And they're concerned with treating gynecological issues. So they'd look after women through pre, during and post pregnancy. They'd also treat both men and women with continence issues. From a breast point of view, they would treat people following surgeries like mastectomies. So that's a really kind of specialist area of physiotherapy, but one that often people don't expect. And we also work in areas like palliative care. So there are physios working for palliative care charities, but also within the NHS. So in smaller community hospitals, for example, Rothbury and Haltwhistle, where they provide end-of-life care, physiotherapists will have a huge role there in trying to work to improve the quality of time that those patients have. So that's a really quick overview of kind of the specialities in which we work. In terms of locations, you'll find us within primary care. So there's been a lot of work recently done on first contact physiotherapists. So they are the physios that are based within GP practices. You might have had involvement with those yourself, but that's where you would go and see a physio as first port of call for a musculoskeletal problem, rather than having to wait and be referred through your GP. So lots of physios in primary care. Intermediate care, we don't see as much intermediate care as there used to be, but we do still have centres like the Bluebell unit in Morpeth, where there are physios working to help support people in that jump from hospital to home. So it's kind of a stepping stone where they just need a little bit more rehab. So there are lots of physios working hard there. We've talked a little bit about acute and hospital settings, loads of physio teams within hospitals, and the main role there is to help with respiratory support, like we mentioned, providing rehabilitation, and then supporting and planning discharge home from hospital. And the last area where you find physios, which is really hugely important in this current climate, is out in the community. So the main role of physiotherapy there is admission avoidance and management of long-term conditions. So I'm sure you've heard so much about the pressures and the burdens on certain points of the NHS at the moment. So we hear loads about A&E pressures on GPs, how difficult it is to get appointments, pressures bed blocking on the wards. And this is where community physiotherapy has a really key role. So our aim there is to really help patients to stay as well and as healthy as they can in the community. Perhaps there are patients who normally would attend A&E, but actually with community physio support, they can be treated in their own homes to avoid that. In terms of long-term conditions, it's helping people stay well and kind of at their optimum so that they don't deteriorate to a point of needing to present to secondary care. So you'd see community physios going out and treating people in their own homes. That happens quite often. But also you'd find them in schools. So in some of the special schools in the region, like the Dale School in Blythe or Collingwood in Morpeth, some schools have physios on their staff teams. Others just work really closely with their local paediatric team, and physios would go in and work with children in those schools that have long-term conditions and build up really good relationships there for their treatment. And also you find physios going into gyms. So I, in one of my previous roles, used to go up to Hurst Welfare Gym in Ashington. I don't know if many of you are familiar with it. but there was a young lad I used to treat there. He had a long-term condition, so every couple of weeks we'd go up and do a physio session in the gym, and then he would know what he could be working hard on himself in between physio treatments. So loads of different places you'll come into contact with physios across the region. So that's kind of the overview of physio and what we do and who we are as a CSP. And I just wanted to talk to you for the rest of our time about a national piece of work that we've done, which is a campaign called Stronger My Way. So this campaign was launched back in March last year by the CSP, and it's all about promoting the benefits of strengthening activity and providing a central hub of resources for both patients and professionals to empower people to become stronger. So hopefully what I'm about to tell you today will be beneficial to you either as an individual or in a professional capacity, just to increase your understanding around the importance of strength and to let you know what we can offer you in terms of support and resources for that. I'll talk a little bit about the background as to why we felt this campaign was needed. I'll show you some of our resources that we have that hopefully will be of use to you. And I'm going to share some stories from some patients themselves as well. So just a little bit of background. I'm sure most people are aware of some of the kind of generic advice we have around exercise and what we should all be doing. So you often hear it spoken about that we need to be doing 20 minutes of exercise 3 times a week. And that's kind of been acknowledged for a long time now. People try and build that into their kind of healthy lifestyle. But back in 2019, the physical activity guidance was reviewed by the Chief Medical Officer. And for the first time ever, they introduced a new guideline based around strength. So you'll see on this image on your stream, this is the guidance on exercise. And right in the center there is the one around building strength. And it's put in the center just to really signify its importance. So what they recommended doing was that every adult needs to be doing strengthening activities on at least 2 days per week. So I wonder, just as you're thinking yourself, I wonder if you feel like you achieve that. I know often I don't, but you might be wondering, well, what do you even mean? You know, what's classed as a strengthening activity? So strengthening activities, we talk about being any activity where you feel like your muscles are working harder than they normally would. So I'm sure you all know the feeling of when your muscles become warm and hot, they may start to shake a little bit, become fatigued, and that's a sign that what you're doing is working on strength. So the stereotypical thing that your mind goes to is being in a gym, lifting weights. So that's a really good example of building strength, but it's not the only way. So through this guideline, they've recognized lots of activities. For example, yoga and Pilates are really good strength building activities. So they're obviously working against your body weight, which helps to build strength in your muscles. Racket sports are also strengthening activities, dancing, but also just your everyday bits and bobs that you do, carrying shopping, going up and down stairs, gardening. They're all activities that help to build strength. So that's all well and good, but what we found was that not many people were managing to build this into their lifestyle. Too few people were meeting the guideline, and to such an extent that it was known as the forgotten guideline. And it was also found that there were lots of inequalities around who was managing to build this into their lifestyle. So women, for example, were much less likely to do strengthening activities compared to men. With people with long-term conditions, only 46% of them were managing to meet the guideline. And it was found that people from a lower socio-economic group were less likely to meet the guideline. And also those from a Black and ethnic minority group were less likely to meet the guideline. So it was very obvious there was a huge gap that needed to be addressed in order to achieve this throughout our populations. So why focus on strengthening? So over 15 million people in England live with a long-term health condition. And as we said in the last slide, less than half of these people were managing to meet the physical activity recommendation set by the Chief Medical Officer. And strength is really important because it helps maintain function, bone density and balance. So this really aids people in keeping independent and not becoming reliant on support. It's quite interesting to know actually that 90% of bone density is developed by the age of 18 to 20. So this isn't just a message for those of us who are kind of starting to feel weaker already as we get older, but it's really important that we drive this message home to children and young adults as well, so that they can set good baselines for health. And we know that muscle and bone strength decline naturally with age. I'm sure we've all been in situations where you say, oh, I used to be able to do that. And that's part of aging, but it's really encouraging to know that we can slow down that decline through strengthening activities. The second point there is that strength helps to manage long-term conditions. It's really important for those of us with long-term conditions that we feel in control of our symptoms. That really boosts confidence. And symptom management is really key when it comes to long-term conditions. And strength also enables aerobic activity. So those who are living with long-term conditions or disability, there are often simple activities that they feel that they can't enjoy because of their limitations. And strength can act as a stepping stone into these activities and help these people to maintain function. This has all become even more important in this current climate. I know we've all heard a lot about the deconditioning patient after COVID. People aren't doing what they used to do, and the general population are becoming more deconditioned. So that just really increases the urgency of intervention around strength. So what did the CSP do? So we spent 18 months listening to people with long-term conditions to find out about their thoughts, their attitudes, their motivations and capabilities around strength. And we also spoke to the physiotherapy workforce. And we did this to try and gauge why it was that we weren't meeting the guideline and what the gap was. So these are some of the findings. I'm not going to talk through all of them, but you can see them there. There are some of the idea people felt benefits of strengthening was. And what was surprising there, we expected the answers of, through strengthening activity, you can improve independence or you can complete more activities. But the surprising bits were around improving physical appearance and improving confidence. That came out quite a lot, and they were kind of probably aspects of it that we weren't expecting, but good to know from a research point of view. In terms of barriers, a lot of the barriers to strength training were around fear. So either fear that what they were going to do was going to make their condition worse, or that it wasn't safe, or fear of embarrassment and kind of the unknown. And in terms of overcoming barriers, one of the important points was that patients felt that setting a really specific short-term goal was really good for motivation. So often we would look into the future and say, well, let's set a long-term goal. In 3 years, I want to be able to do this. But the feedback we got was having really clear short-term goals made more of an impact. So from professionals, the information that came back was that there was a lot of evidence around strength. There were a lot of resources out there on the internet to search for, but they really would benefit from a one-stop kind of hub or toolkit, somewhere where we can bring together all of the available resources and links where professionals can log on and get the information that they need. So from there, we built our online hub. So the hub is the Stronger My Way hub, and it's hosted on our CSP website. So the easiest way to show you it is just to show you it. So I'm going to click on the link here and show you what you see when you click on our website. So it's found on the CSP website, and you'll have the slides afterwards. So you have this website for reference. And just bear with me while I just extend this so you can see the full bit of the screen. So this is part of our website, the Stronger My Way hub. And as you scroll down, just shout if you can't see this. I'm presuming that because it's quiet, everybody can see, but do let me know if there's any issues. As you scroll down, there are 2 entry points on the Stronger My Way hub. So I help people feel stronger. This is the entry point for professionals. And I want to feel stronger. This is the entry point for the public or patients. So I'll click on the patient one first and let you see. So when you come onto here, I want to feel stronger. There are all of these different resources. So the first bit, what is strengthening? This is just all of your background reading. what came really clearly through the research we did was that there was a lack of knowledge and understanding. So lots of background reading around what strengthening is. I'm just going to give you a whistle-stop tour of this. I'm not going to go into it all. But there's some examples there. So dancing, hill walking, cycling, football, things that people might do anyway and not acknowledge that they're doing strengthening. Managing action of how you would feel afterwards, etc. So that's really helpful from an education point of view. For people who don't know where to start, so perhaps they feel motivated to do strengthening, but they don't go to a gym, they don't have anyone to educate them on what to do, where to start. There are some useful exercises, things that you can do in your own home. So upper body exercises, strengthening exercises for your whole body, strengthening exercises for your lower body. Oh, sorry, gone too far there. And using outdoor gyms, lots of these are popping up everywhere, so they're quite popular as well. There are some patient stories, so we're going to share some of those after this in the presentation, just to see the impact that strength has had on members of the public. And then how to set a strength goal. So as I said, this came out as something that was really key for patients. And some patients, as physiotherapists, we're really used to setting goals, but members of the public, you might not be. It might not be something that you've ever done before. So on here, there is a resource, the activity sheet template. So this is really helpful for kind of setting your goals. So I want to be able to, you can pop in what you want to achieve, the date, and then it's almost like a reflective diary. So what are you doing to achieve that goal? So you can fill in a little bit about what you've done, how you felt before, during, after, what felt challenging. And it's kind of a diary to keep you on track with what you're hoping to achieve. And then we have links to other activity campaigns that are linked in with Stronger My Way. The next bit, this is one of the most popular parts of the website, and we get a lot of traffic to this area. And as I discussed earlier, one of the barriers to strengthening was patients thinking, oh, I don't know if this is going to be appropriate for my condition. So on here, it talks through some really specific areas of health. So it makes it a lot more personalized for you. So getting stronger after a stroke, with cancer, with heart disease, with MS, with chronic pain. So you can click on all of those and get some really specific advice tailored to your health condition. And then again, just some inspiration with different activities that you can do. So there's some kind of stories here around dancing, gardening, climbing. So lots and lots there for the public to read through. In terms of if you're a professional, you can come and click onto the I Help People Feel Stronger tab. And this has all of the evidence surrounding strength, all of the evidence there that helped influence this new guideline. So it has guidelines, it has lots of links to kind of evidence-based practice in there for you to kind of make sure that what you're advising or what you're doing is really relevant and really backed by good quality work. The training aspect is really good and really helpful. So it might be that there are people that you work with who you think would really benefit from strength, but you don't feel equipped to be the right person to do that. Or you might think, you know, these people have developed behaviours all of their lives. One conversation around strength isn't going to change that. Where do I start? So there's some really good training resources here. So for example, behaviour change. If you want to work with somebody, it might be a professional, the patient, or it might be even just a family member or a friend, and you know that it needs to be behavioural change, you can come on here and you can take courses to equip yourself to have those conversations more effectively. From the professional point of view, it still links you through to the patient page, so that just takes you to everything we looked at earlier. Promotional resources, so in here are posters, social media images, infographics that you can use. You can download them, you can display them, you can use them for however you like, but just with the Stronger My Way messaging, and just to really help you start those conversations around strength. We have an ICSP strength community that's for our physiotherapy members to start conversations around strength and discuss how perhaps they're implementing this in practice. Become a Stronger My Way ambassador. In here are some stories of professionals who have just implemented some small changes in practice that have helped them start conversations around strength with their patients and seeing the impact that that's had. And then the last section here that I'm just showing you very briefly is top tips for first contact physio. So there are tips in there of how you can implement about into your clinic sessions with patients. Obviously, this is physiotherapy based because of what the website is, but this is accessible to the public, so you can jump on here and have a look for yourself as well. And there's lots of information that will be useful for you too. Just bring my screen back. Okay. So that's the website. Really quick tour. Please go on and have a little look yourself when you have a bit more time. So that's all well and good, but what impact can all of this have within Northumberland? So I think anyone who's lived here for any time knows that the statistics for health in the North East don't make particularly good reading, do they? So life expectancy at birth in the North East is the lowest in England by 2 years. So just by being born here, we're already off to a disadvantaged start in life. People in the North East spend 25% of their lives in poor health. The national figure for that is 20%, so we're quite a bit higher than the national average, which just means that there are so many more people in our communities living with disability or with long-term health conditions, and they're the people that we can really target with this advice to make a difference. We also have the highest preventable mortality rate nationally, which just suggests that there's behavioural elements to how people in our area live, and that's again just an opportunity that we can perhaps impact or influence. And this statistic was quite significant for me, I think. So 9.8% of people in the North East report that their day-to-day activities are limited by disability. And you'll see that that's actually quite a bit higher than the national average, which is 7.5. So again, there are lots of people living in our communities who, it might be yourself in this room, who just feel like they can't achieve what they want to achieve because of disability. So again, there might be something in this messaging that's helpful to those patient groups. The North East and North Cumbria integrated care system have recognised these inequalities in the North East, and thankfully one of their goals in their strategy is to achieve longer, healthier lives for the people of this region. They have set a really clear goal that they want to decrease the gap in life expectancy, and particularly healthy life expectancy. So the gap between the North East and the rest of the UK, they want to decrease that by 10% by 2030. So I know that's a lot figures, and I'm not suggesting for 1 minute that this alone is going to tackle that, but it's just encouraging that it's on their agenda and that it's been acknowledged. And I think that if we know that we have more people living with long-term conditions and being limited in daily activity by disability, then we, so myself and my colleagues as physiotherapists, and perhaps you in your line of work as well, we have a huge opportunity to target and support these individuals with the right information and the right resources to help improve their quality of life. And it's highly likely that we're coming in contact with these target groups every day. It might be friends, family, through work. And there might be, as we're talking, there might be people that just pop into your mind who fit into some of these statistics. So big opportunity there to talk to them about improving strength, to help them manage their long-term conditions, and to encourage them that they can slow the decline of muscle and bone strength, or perhaps just to encourage them that by working on their strength, it can act as a stepping stone to get back to some of the activities that they perhaps think that they can't, to help them achieve their goals. So how can you get involved, and how can you use the Stronger My Way hub? We understand that your time is precious, but I think there are some really quick and easy ways that you can use what we've produced to just help impact either your own life or those around you in work or in personal life. So lots of things you can do. The first one I'd encourage you to do is just become familiar with the website and the resources on there. As I said, you'll be shared the slides afterwards, so the website is on there. Go and have a play, have a read through of some of the stories and some of the tips. Just familiarise yourself with the importance of strength is kind of the starting point for you. It might be that you in a workplace, you want to display some of our posters, by all means download them and put them up on the wall, and it might just start a conversation around, well, what's that all about? And you can give patients or colleagues a little bit of a snapshot into it. You want to embed some of these principles into your working practices. So it might be that you feel really inspired from today's talk to go and put Stronger My Way onto a agenda for a meeting that you might have, or it might be that you want to do like a CPD session with your colleagues to show them the website and encourage them to go and have a little peek for themselves. Any of that we'd really, really appreciate. Or it might just be that you want to go and watch the videos of how other professionals have introduced Stronger My Way into their practice and give you some ideas. But I think the main message is just for yourself and for those around you to just be really encouraged that making small changes to address your strength can have big impact on quality of life. So just to finish off, I just want to share a couple of patient stories just so you can see really practically how this has made a difference. I feel I've done a lot of talking to you, but just to hear from patients themselves is really effective actually. So I'm going to play Andy's story and Sarah's story. Again, I'll assume that you can hear these. If there are any problems with sound or anything, if someone could let me know and I'll have a bit of a play. But I'll play Andy's story first.
So I'm Andy, and 3 years ago I had a stroke that affected all my left-hand side, so I got no use in my arm and leg, and it affected my speech as well. Before my stroke, I used to rock climb at the local climbing wall, and I played guitar, and I went from that to being in a wheelchair and not being able to do anything for myself. And I wanted to get back to doing those things that I really enjoyed. So initially I had neurophysio with a specialist physiotherapist. She suggested that I use the strength and conditioning classes to build up further and get back to full fitness and strength. And I took a lot of the exercises that I was doing there and started doing them as and when around the house. And I tried to build them into bits of every day almost. If I put the kettle on to make a cup of tea, I've got 2 minutes there where I can do some press-ups or something. And it's just little bits like that and bits of stretches here and there. It's just slotting them in around daily activity. For over a year after I had my stroke, I could feel myself getting stronger and stronger and able to do stuff that I thought, well, I can do that now, and I couldn't do it 3 months ago. It was a really encouraging and kind of motivating thing to keep going with the exercises. It's worth every bit of the effort. So now I go climbing once a week to the climbing wall. I play the guitar as and when I can find time to do it, and I do all sorts of other things. I can cut the grass, I can do the gardening, I can decorate the house. The strength and conditioning were key to getting back to this level of fitness. I feel so lucky and so grateful. It's been brilliant.
That's Andy. We'll now listen to Sarah as well, who gives a slightly different perspective on it.
Hi, I'm Sarah. Quite a few years ago, I developed mobility problems. I have a lot of spasticity in my legs and my limbs and a lot of stiffness and weakness. My goal is to ultimately be independent and be living on my own, getting around the place. I would love to work abroad. I've been doing a range of strengthening exercises at home, such as squats and lunges, press-ups. Trying to fit them in with my schedule isn't always easy, but I always try and make it work somehow. Like, I would do squats when making a cup of tea, just hold onto the counter, and while the kettle's boiling, do about 10 squats. Or like going up the stairs, doing 2 stairs at a time to build up the strength in my legs. Just little things like that, trying to sneak them in. Doing these strength exercises has made me feel a lot more confident, a lot more capable, going out and doing things and basically living my life more independently. It's made my mood better and I feel so much better in myself.
So on the website, both Sarah and Andy, under the patient area of the website, in Strength Stories, they have shared some little videos of their what they call their tea break exercise programs as well. So just little things that you can do at home while you're putting the kettle on for a cup of tea. So really helpful tips and tricks from them as well. So that's all I wanted to share with you today. On this last slide, we have obviously the website. So it's csp.org.uk/strength. That takes you straight to the strength pages that I showed you. There's also an email address there if you have any specific questions. We have a team of colleagues who work on strength as their project, so they're always welcoming any kind of thoughts, questions through that email address as well. We're going to have a little break now for some questions. Unfortunately, I know you might be watching that thinking, oh, I've got a really specific question around my condition or specific services. I'm unable to answer really specific questions around that just because I'm not employed as a clinician, so I can't offer specific advice. So if you have any kind of specific questions off the back of today around your own circumstances, then please, I just encourage you to either chat it through with your GP or through your physiotherapy services. So have a look at your website for local physiotherapy services, or drop, there's always email addresses just to get some more specific advice. But I'm more than happy to take any questions around the presentation or anything around physio. So I'll stop sharing my screen there and take us back to the main